through the telehealth service on the Lumi app before I hand it over to Dr. Rima, who will carry on with the presentation today. So Lumi by NextCare is a new and revamped app that you all have access to. In addition to helping you with claim submissions and pre-approval status checks, it offers you a seamless health service and access to a lot of digital services as well. It's a really fast and easy app to use, and it completely simplifies the management of your whole health insurance. So simply put, you can view your policy benefits and issue the certificate issued to you, where you can see all of your policy coverage. You can check your symptoms through an app called the Symptom Checker. You can book a video consultation with a doctor using the telehealth service on the app, which is where we come in from Health at Hand. You can search for a healthcare provider as well, so you have access to all the doctors and the clinics and service providers that are covered in your network. You can search for them on the app. You can even get assistance instantly. There is a help section on the app, and you can chat and get updates and status. And even if you want to ask questions such as, "Is this covered for me?" it will assist you with that. And most importantly, it will help you to track and keep a check on all of the claims that you submit on the app. Now, specifically with the telehealth benefit on the app, it's a very convenient consultation solution that you have access to, and it's available to you throughout the policy term. So you can have consultation 7 days a week. You have access to all of your reports. You don't have to write and request it to us, be it your doctor's reports or any lab tests that the doctors have requested. We make it available on the app instantly. It's a confidential and secure platform, and it complies with all of DHA requirements. We also, if the doctor, we're a full service clinic. We have doctors and nurses as well. So if the doctor after a consultation says you need to have a lab test done, we can arrange for the lab to come to you. And the same thing applies for any medication prescription that's been issued to you. We can have the medicines delivered to you as well. A very, very that you need to keep in mind is that there is no copay or deductible for the teleconsultations you have with us. So you can have as many teleconsultations as you want throughout the policy term, and there's no copay applicable on it. If you have a condition that requires you to have medications refilled every few weeks or every 3 months, we can do that as well. Our doctors can issue prescriptions. Of course, you will get on a teleconsultation with them. They'll check your history. They'll want to see copies of any previous prescriptions you've got, or even the dosage label on the medication box, and then they can get started with getting that refilled for you. Our doctors can also get a sick leave certificate issued. They can issue a DHA sick leave certificate. Again, all of this can be done by the app. And as mentioned, any prescriptions that have been issued to you, we can even have that delivered to you. So the delivery service itself is free. Any copay that's applicable on your medication will apply. And that was it. Now I will hand over to Dr. Rima, who will continue with the presentation for today. Dr. Rima, you can share your screen now.
Assalamu alaikum. Good afternoon, everybody. Thank you, Cynthia, for the introduction. Just give me a minute to share my screen. Are you able to see my screen now?
Yes, we can see it.
Okay, great. So thank you, everybody, ladies and gentlemen, for attending this session. It's a very important topic in regards of women's health, and she's not just any woman. She's a mother, she's a daughter, she's a wife, and she's a sister, and she can be a friend. So today we'll be talking about the breast cancer awareness, since it's the month of October, and everybody knows the pink month. In our topic today, we'll be talking about the breast anatomy and about the risk factors of breast cancer. And then we will be talking about how to modify these risk factors and the screening procedures. For any questions, we will leave it at the end. You can put any question in the chat box if you like. So first, we'll be talking about the breast anatomy. As we can see in the diagram, the breast is made of 3 main parts, which is the lobules, where the milk is produced. And then there are the ducts where the milk is moved in tracts or ducts to the nipple for feeding. The breast is also made of connective tissue such as fat and fiber, which gives it gathers all these structures together and gives it its shape. Breast cancer or any type of cancer is an abnormal growth of cells that can lead to for a lump forms, and this lump is abnormal. There are different types of breast cancer. There, as we can see in the diagram, there is a ductal breast cancer, the mixed tumor breast cancer, which involves the ducts and the lobules and the other tissue of the breast. There is the inflammatory breast cancer involving the skin, and the mucinous breast cancer and the lobular breast cancer, which involves the lobule. The most common types of breast cancer is the invasive ductal carcinoma, which involves the ducts, and the invasive lobular carcinoma. Why is this topic important and why the whole month is dedicated for the awareness? Because breast cancer is very important, is very common, and it is the fifth leading cause of women in the United States, and it is the second type of cancer, death of cancer after lung cancer in women. 1 in 8 women will be diagnosed with breast cancer. That's how common it is. Every 2 minutes, a woman might be diagnosed with breast cancer in the U.S. Every minute, somewhere in the world, a lady is dying from it. While death from breast cancer is reducing because of the awareness, because of the early detection and the medical improvement and treatment that is available, still there is a high incidence of the breast cancer. Women who get regularly screened for the breast cancer have a 47% lower risk of dying from the disease. So what are the risk factors? The main risk factor is being a female, and the second main risk factor is aging. It is common above the age of 50. So as a risk factor, being above the age of 40 is considered one. Early menstruation before before the age of 15. Alcohol consumption, smoking, dense breast where they have less fat tissue, and genes. There are some people who have gene mutation for the BRCA1 and BRCA2. Those are exposed, and they are exposed to have the breast cancer, and they need to do. They are considered of the high risk, and they need to do regular screening. Having a late childbirth, late age of menopause, family history of breast cancer or ovarian cancer, and hormone therapy, such as some people who use combined contraceptive pills. These some of these risk factors, as the hormonal therapy, as the early menstruation, or the late childbirth, or the late menopause, is exposing the body to a high level of estrogen, which is a predisposing factor. Men do also get breast cancer because they have breasts. And the risk factors for men is genetic mutation, such as we said earlier, if they have the gene mutation for BRCA1, BRCA2. Family history of breast cancer, a first degree relative who have like a mother or a sister or an aunt, if she has the breast cancer or ovarian cancer. Radiation therapy treatment, hormone therapy treatment, such as those who have prostate cancer, they undergo some hormonal therapy. Klinefelter syndrome, in which these people have an extra X chromosome, predisposes them to have the risk factor. Certain conditions that affects the testicle, liver disease such as cirrhosis, where they will, because of the fibrosis of the liver and cirrhosis of the liver, the estrogen level will be higher. Being overweight or obese. So now we know the risk factors. Now we need to be aware of these risk factors and how to modify them. There are some non-modifiable risk factors, such as aging, such as being a female, and if they have the gene. But the modifiable, the other risk factors, such as obesity, being a smoker, alcohol, and those stuff, we can modify it by improving our diet, improving our lifestyle, being more physically active, doing more exercise. If you're considering for contraception or hormonal use, you need to discuss that with your doctor if there are any other alternative ways. Quit smoking, reduce your alcohol consumption, monitor your weight and reduce it if it is getting high. Get your screenings done. So what are the symptoms? Symptoms of breast cancer, the nipple retraction, and sometimes a lump in the armpits or in the breast, discharge from the nipple, having a skin change, which we call pseudo orange, and because it is similar to the skin of the orange, and if there is any inflammation, that can happen. And if they notice asymmetry in the breast, that's another symptom. If anything of these are they have noticed, you need to call us. We will help you, or you can go to the clinic, visit the clinic. Sometimes you might find some changes, but it might be normal or it might be a benign lesion, not a malignant. But you need to be aware of it. You need to check it out. Don't leave it. Your health is important. Hopefully, there is treatment now compared to the 1970s or 1980s, where the death rate was very high because of lack of awareness, because of there were no different treatments available. So for the treatment, it depends on the stage of the cancer, the type of the cancer, when it was diagnosed, and the age of the person, the risk factors that the person has. Surgery, it can be done into either just removing the lump if it was just a local lump and it was localized and it's an early stage, or sometimes mastectomy has been done in the total breast removal. Reconstructive surgery of the breast is available and can also be done at the time of removing the tumor. Radiation therapy is another modality of treatment. Chemotherapy is there. Hormonal therapy is there. And the new modality of treatment is the biological immunological therapy, which are medications that target the immune part of the cancer cells. Survival rate depends on the stage of the cancer at time of the diagnosis, the grade, the type, and the age of diagnosis, presence of other risk factors, and the age of the person. If the cancer was diagnosed by mammogram at an early stage, before even a lump has been noticed, the 10-year survival rate is 95%, which is very good. If the lump was the first time, the 10-year survival rate is 85%. And 34% less chance of dying since free screenings has started and people have been aware of doing screening. So how we can prevent the breast cancer? We need to do a self-awareness and self-breast examination, clinical breast examination, mammogram, and as we said earlier, lifestyle modification. So for the breast self-examination, any lady above the age of 20 is advised that on the 5th or 7th day of her period to do a breast self-examination. Why on the 5th or 7th day of the period? Because at that time, the breast tissue is more soft. It is more comfortable to check it, and it's not heavy or it's not thick. Some people on the time of their period, their breast gets a bit lumpy, so it is difficult to distinguish it. So how the breast self-examination is done, it is advised that to stand in front of the mirror without the clothes, hands by the side, and observe it for any asymmetry, any nipple retraction, any lump, any skin change, and then raise the arms and again check. Then you need to palpate your breast in a circular direction, starting with the axillary area, with the armpits, to see if there is any lump, to see if there is any change, and then on the breast, and then the nipple, and pressing the nipple to see if there is any discharge. Why it is advised to be done every month? Even for ladies who are pregnant or those who are on menopause, to be familiar with the breast, to be familiar with how your breast looks and feels, because if any changes there, then you will detect it. Clinical breast examination is advised to be done almost every 3 years in the clinic by a trained nurse or a doctor. It is more frequent examination for those who are at high risk, and we will be talking, these who are the high risk. It's the lady who had a history of breast cancer or ovarian cancer, a first degree relative with the breast cancer before the age of 50, having a gene mutation, the gene for the BRCA1, BRCA2, TP53, and if they had exposure to chest radiation before the age of 30. These ladies or this group is considered a high risk and they need more attention and more checkup. A mammogram is advised to be done for any lady who's above the age of 40. A mammogram is an X-ray or X-ray picture of the breast. It has minimum radiation with minimum discomfort. recommended to be done on the 5th or the 7th day of the period, so you will have less discomfort. It's a very short procedure, and as you can see in the picture, the breast is put on two plates which press them in different directions to get different images of the breast. And it is advised to avoid applying any perfume or any deodorant on the day of the procedure, so it does not give any white shadow on it. The mammogram is then evaluated by a trained radiologist, and not every abnormal mammogram indicates that there is cancer. Sometimes it can be just benign lesions which need a regular checkup. It is advised for ladies between the age of 40 to 44 to start the screening with the mammogram every year, and they have the option every year or every 2 years. But after the age of 45, you need to push the lady every year to do this mammogram for her health. And at the age of 55, they can switch to a mammogram every other year, or they can choose to continuously do it yearly. And from my point of view, do it yearly because we care about you. So in conclusion of today, your health is important to us. At the age of 20, you need to, from the age of 20 onwards, you need to do your monthly breast self-examination on the 5th or 7th day of the period. After the age of 40, please go and have a mammogram. And if you need that, you can contact us. We will arrange it for you and help you with it. You matter to us, you matter to your family, so please take care of your health. Thank you everybody for joining us.
Hello, everyone. This is Dr. Shaima from Fidelity United. I'm the medical claims manager, and thank you so much, Dr. Reem, for giving a very insightful message at the end and giving us full, details of how and why is this, cancer detection is important, especially at the early stage. So, thank
I'm
you.
happy to be here.
Thank you so much. And as Dr. Reem had mentioned, this is a very important topic that we have, although everybody is aware, but I think it's the matter of coming forward to actually do the needful examination and detection, whether it's going to be a self-examination or going to the doctor to get the examination done. Many of us are not actually aware of the symptoms, and sometimes we take the symptoms very lightly too. Okay, so we have actually seen that in the latest years and of late in UAE, we have actually seen the incidence of breast cancer rise to a greater level. Although the death incidence has been has come down, the incidence of the cancer itself has been high now. And one of the best things that we should be I would be proud to say is that UAE has one of the best advanced, treatment available for, tackling this need. And we have the best of the best surgeons and center of excellence here too. And DHA's initiative to carry this screening and, the BASMA program and the patient support program that is being provided has been of a great deal to all those members, even of the lower salary based category, to avail the treatment at the fullest. Having said this, I would like to, I would like to open the session for the Q&A. If any of you have any questions, if you feel like asking anything based on the presentation that was made by Dr. Reem, or if you have any personal questions too, you can drop in the chat window, and we can definitely take it forward.
Yeah, and if you're feeling shy about the question or you have it very personal, you can contact us on our application, book an appointment. We will help you in a private way.
Definitely.
Yeah.
So if anybody is interested to ask any questions. We will keep this session open for the, for the questions. But meanwhile, Dr. Reem, I would like to ask you something from a broader perspective. In terms of the chemotherapy and the radiation therapy that is being, administered here for the patients of breast cancer. Let's say, for example, we have two of the major types of cancers, which is very invasive. One is the ductal, the other one is local, right? So, which type of cancer, as you see from your perspective, is actually being is a chance for improvement using these radiation and chemotherapies at an earlier stage?
Well, it depends on the type of the cancer and when it was diagnosed and the risk factors of the patient to determine which treatment will help. Sometimes they start with the surgery and then followed up with radiotherapy to get sometimes the surgery cannot remove all the cancer cells, some remain, and that's why they do the radiotherapy, and then they're maintained on the hormonal or chemotherapy. It depends on the stage.
Okay. And in terms of, let's say, for example, when we talk about the invasive ductal carcinoma that is currently prevalent in, in most of the women right now, what do you see as the age incidence being very common for invasive ductal carcinoma? And could you, what do you infer from the same as well? Why do you think that they have, this age group has got more of invasive ductal carcinoma than the other age group?
Well, that's really a good question, and I think we need to look into exactly what the cause is. Some of the, it depends, I think, also on the genes, if they have the genetic modification, if they have the family history, and maybe some other risk factors. Although, some people who are diagnosed with breast cancer, they might not have any risk factor. It can happen.
True to it. And Dr. Reem, let's say there are oncologists now who is more interested in seeing the genetic mutation right now. That they actually try to base the type of regimen that has to be provided to each type of patients based on genetic testing. So, would you like to please shed more light on what is the importance of this genetic testing, and what helps further as well?
I would love to share this information, but I really don't have that much experience with it. And I can look into it and we can share this information. Yani, we can look into it and share the information in the future. But I know that tests are being done, studies are being done for the genetics, and a lot of modification has happened. And that gives a lot of hope that in the future it can be done and prevent. I've heard about the CRISP study that's been done that they can change in the gene itself and remove a gene or add a gene. But I think these are some studies, and I don't have that much of expertise in this to talk about it, and I don't want to give any misleading information.
No, I totally agree with you, Dr. Reem. I have also read that article where they have actually done the gene, gene modification to, to stop this, not at least to stop, but it's still in the clinical trial. We don't have a established diagnosis yet, right?
So exactly. They did the test on rats, I think, or something.
Yes, exactly. Not on humans yet. But I do think at this point of time, the gene testing that they actually do is more on the type of regimen that they have to choose for the type of cancer that is being prevailed around, and each patient differs from others. So I think that would be the source now for the gene test, the genetic mutation test, especially BRC genes as such, right? Yes. Thank you so much.
More personalized or patient-centered approach, like we do with maybe other diseases.
Thank you so much. And based on your experience, Dr. Reema, how do you think, how are the women taking this, how seriously are these women taking this, screening and tests? I mean, based on your experience over the past years, are you seeing more females coming towards to get tested, get screened?
Well, nowadays, comparing, let's say, to 10 years ago, people, because of the awareness, ladies are coming forward and asking for it. And maybe in October, we see a higher rate of people asking for it because of the awareness, although any time is a good time to do the screening. Before, people were a bit shy, or some of them, they might feel shameful and they don't want to go to the clinic for any reason. And some people, and some ladies, they prioritize other people or their families on their own health, and that delays them from the screening. That's why we are pushing the ladies to go and making the guys aware that you need your lady next to you. So please go and send her to do this and get the
That's true.
screening
That's
done.
true. The hesitation is still there,
Yeah,
and
the hesitation is still there. And some people, they get scared, or yani when they're talking, that it might be painful, it might be uncomfortable, this might happen, it might cause cancer or something like that. That makes them more hesitant to go for it. But when they're aware, they will go for it. And maybe if one lady, usually ladies are in groups, and one lady is leading this group. So if this leading lady group is doing it, so everybody will follow.
true, true,
That's why
doctor.
awareness is important, and it's an important thing to talk about, and and go get it checked out. In addition to other women health home screening tests, such as pap smear, such as the HPV screening, getting immunization, vaccination, and flu vaccines, and other preventive methods for women and other people. Yani.
That's true. Thanks a lot. Thank you so much, Dr. Reen. So, if anybody is interested to, ask any questions, please drop on the chat window. Got a very interesting question, but I think since we are already, it was in one of the slides, but I think Dr. Reem, if you can help us to give some more insight on this. They would like to know, I mean, one of our team member would like to know, is there any certain food to avoid to prevent breast cancer for, most prevalent age groups or something?
Yeah, that's really a good question. As we said earlier, it depends on their lifestyle, and if you're overweight or you are obese, you need to modify your diet. It in general for everybody, not just for people who are at risk. It is advisable to balance their food, not to have a lot of carbs, and balance it between the vegetables, and have a lot of fibers, so you don't, and reduce your fat intake, or, so you don't get overweight. But I cannot say there is a specific food that will avoid, will cause the cancer or will avoid it. It's a general. If you are in a balanced diet, then you are being, and if you're being honest, your BMI is in the, and it's in the
Normal range?
normal range. Yeah, thank you. If it's in the normal range, then you are in the safe side. And you're not just preventing breast cancer, you're preventing other diseases such as diabetes, hypertension, back pain, and other stuff.
Do preservatives and the preservatives and tinned canned foods, I think these are one type of sources of food as well that could be avoided, right?
Yeah, I agree with you that artificial things can be avoided. Yeah,
Yeah,
that's
because
why.
now we are more on the fast food, and
Okay,
we would
yeah,
like to
I'm
just
doing
grab
some
and
very.
go. So I think these kind of food are some of the some of the reasons why we can actually see a rise in the incidence of cancers, not only breast cancer but different other cancers as well,
Yeah,
right?
okay, that's true. Even if you are using plastic, that can affect also.
Yes,
So the
plastic.
plastic
Yes,
with
that is
hot
one
food
of
and stuff like that. Yeah, that's an
very true.
important thing.
And how
Yeah.
do you, what do you think about these, hormone-induced non-veggies,
Yeah,
non-vegetarian food?
these might be also another contributing thing. And studies have not, they're not showing us that much
Proven,
of,
yes.
studies that prove that, but we need to take care.
But I think these foods are also contributing to early menarche in kids as well, because we have seen a rise, and I think there are some close studies that have been made as well.
Yes, you are
So
right.
I
Totally agree
hope
with you.
so I hope we have actually answered your question for that. We have another question, which is once one is diagnosed with breast cancer, does the chemotherapy come first or the mastectomy?
Okay, that's really a nice question. It depends on the type of the cancer, when it was diagnosed, and the stage of the cancer and the patient condition to decide which comes first. Sometimes it might be a very early detection and only the lump itself needs to be removed. And sometimes it might be a big lump, or and it's more extensive, then other modalities of treatment will come in. This is decided by the oncologist, and it requires a team of oncologists and radiologists to decide.
To put the perspective very clear, not all cancers have to have mastectomy done. Not all cancers have to have chemotherapy done. It depends on the site. It depends on the extent of the cancer. If the cancer, as what Dr. Reem had mentioned, if it is just a lump, removing the lump and then screening the patient for a couple of months to see if there is any spread or if there is any new growth, that would decide whether they have to actually go for the next step, which would be the mastectomy or the chemotherapy based on the. And chemotherapy is more prevalent on areas when you see an extensive growth or if you see a spread in your body, because that actually helps to kill all the cells within your body, which is prone to grow this group of this group of tumors. And unfortunately, cancer not like other cells, but cancer cells multiply and they spread very rapidly. So it all depends on the stage at which we detect this cancer. Thank you so much, team. So if there is any further questions. Okay, so I think that's it, Dr. Reem. So on behalf of Fidelity United, we would like to thank you for this extensive presentation. And we would definitely, the teams, the members, whoever is watching this video or whoever wants to share this video with your, with your closed ones as well to spread the awareness. It's a responsibility for all of us. Okay, there is a question. Any free screening services available to get this tested? I think a couple of facilities in UAE do offer some free screenings, but it's limited. I mean, just the just the examination, and then you may have to pay for it if mammogram or other tests have to be done. But you can actually review it. We have some offers and vouchers which will be shared up later to you as an employee, and we would you can avail one of them to get to go forward for testing. And Dr. Reem, thank you so much. It's a wonderful presentation, and thank you for your time and patiently explaining to the team how it goes and this one. It was very insightful. And to every one of us, I think we are individually responsible to spread this awareness to our loved ones, to the family that we really matter to. And I think this initiative is coming from all of us. It's not only the ladies, but it's also for the men to do as well.
Yeah.
All right. Thank you so much, Dr. Reem.
Thank you very much, Dr. Shaima. It was my pleasure to be here, and I hope all you have a great day. And I hope I have empowered your knowledge today and made you more aware about this condition. So have a great day. Take care.
Have a great day, all of you. Thank you so much.
Thank you. Bye.